Hi everyone, this is Neel Raithatha, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope, and we have a really interesting case. So this patient went to see another specialist previously who really struggled with their ears, and understandably so. They've got extremely narrow ear canals, and in fact I commenced with our medium-sized specular, the 4.25mm. But given how narrow the ear canal was, I then switched to our paediatric size specular, which has an opening at the tip, which you can see on screen, of 3.5. And even then, it was really difficult gaining access into their ear. Now, this was the better ear out of the two. And what you've got here is some dry, crusted wax and skin right on the eardrum. So following their previous appointment with another specialist, the specialist provided my contact details, but before arranging to see myself, they thought they'll try and clean this themselves, and they used a cotton bud. And in the left ear, they have caused some trauma to their eardrum, and there's a lump of wax that's dried up with blood, and that's stuck on the eardrum. So do stay tuned for that. We're going to remove that, and you'll see the eardrum afterwards. Now, although the eardrum was heavily bruised, hematoma, there's inflammation. Fortunately, there wasn't any perforation, and I did double check that after removing the blood-soaked wax using a pressure test that we have in clinic called a tympanometer. And so I've more or less managed to extract this from the ear. Sometimes when it's really dry and crusted like this, it can be difficult to get a suction grip, but I've just managed to tease this out the ear. So we're now going to re-enter the ear and have a look at the eardrum, which was healthy and intact. So we just got that in focus. So there's the light reflex. Got the hammer bone. So we're now going to move on to the left end. You can see they've also grazed the entrance of the ear canal. So this is some dried blood alongside some wax. And this ear was even narrower. So in fact, the patient did really, really well to poke in their ears. When you've got narrow ears like this, sometimes it's when I'm struggling to even get the specular in. So I've just zoomed in here. This is right on the eardrum. And it did take a little prizing away. It wasn't straightforward removing this. With dried blood, it can crust and really attach itself, whether it be to the canal wall or the eardrum. So there's a bit of skin just at the entrance here, which is just obscuring the view. So I'm just going to suction that way. It's going to get the eardrum back in focus. And then it's going to re-enter. And I think I was using the 16 gauge suction probe here. So it's a slightly smaller one than the standard Zollner suction probe, which is a 14 gauge. And I thought I'd try that first because we're approaching the eardrum. 16 gauge is a bit smaller in diameter, and it's also a little bit less noisy. You can see some of the blood around the edge of this as well. So I'm just making contact. I've got to be careful not to apply too much pressure because this is on the eardrum, and by applying pressure, we're going to be pushing up against the eardrum, which can be uncomfortable. I'm not having much joy at the moment. It's really stuck. Now, there is a bit of wax at the bottom, some dead skin that they've also compressed against the canal wall. So in a moment, I'm going to remove that. And this patient was lovely. They actually called back after the appointment, and bless her, she said that people often complain and quick to complain, but people are not as quick as to compliment or say thank you, and they just called back to say thank you and left a message with Tracy to pass on to me, which is very nice of them. So again, I'm just going to stretch open the ear as much as I can. And I purposely used the WAXscope here because this is one of the reasons why I developed the WAXscope. So with an endoscope, if you're really skilled with an endoscope, the views, and I did actually look with the endoscope, you just get this incomparable field of view, but using an endoscope is quite difficult and requires a lot of training. So once you've mastered the endoscope, however, it's almost like, for myself, because I've been using it so many years, it's like my third hand. But if anyone that's new to it, it can be difficult, and sometimes people really struggle to get to grips with it. So I decided to develop the WAXscope for that reason. So endoscopes can be really, really difficult with narrow, twisty, bendy ear canals. So using the forceps, and because I want to grab onto this piece of crusted wax skin with the jaws at 12 and 6 o'clock, you may have seen that I rotated the specular so the slot was more at 3 o'clock, but it just wasn't grabbing, it was just tearing this away. So I've just gone back to suction for the moment. Now, in the end, I managed to remove that blood-soaked wax, so the combination of suction and forceps. But just wanted to get this away, because sometimes this could be attached to that bit of blood-stained wax on the eardrum. So by removing it, you can peel away that, but a part of it was attached, but in a minute I'm going to remove this, and unfortunately for me, that piece of wax on the eardrum didn't come away with it. Okay, I'm just trying to stretch open the ear as much as possible. So what you're seeing is the back half of the patient's eardrum. The front half you're not seeing at the moment. But once we remove this, we do examine that part of the eardrum as well. And I'm almost trying to drag down on it. The patient throughout was completely comfortable. I did ask him on various intervals, because it is stuck to the drum. We're working very deep in the ear. It is a sensitive part of the ear, the eardrum, and also the inner two parts of the ear canal, where that's the osseous portion. The outer third of the ear canal is made up of cartilage, and it's got a thick layer of skin around 1 millimetre in thickness, whereas the skin that lines the inner 2/3 of the ear canal is approximately 0.1 millimetres, so it's wafer thin. And if you do make contact with the bony part of the eardrum, I always compare it to if you knock your shin against the side of a door or chair. It's a very sharp, acute pain. Now, this is beginning to loosen, so I just kept the suction probe on there as much as possible to strengthen the suction power. But now it's quite difficult to get a suction grip, because we've got the side sharp ridge of the dried wax. So I think I'm going to go a bit lower again. So the bottom half is still attached to the eardrum. I've detached the top part. I think the patient just had a few hairs in the way there, so I was just pulling them out the specular. So this is almost like a shard of glass. It's so sharp around the edges, and the surface is like sandpaper. So bringing this out, if you rub against the canal walls too much, that itself can be uncomfortable. But now I think I'm going to use the forceps, or I will do in a moment. I think before I do that, I'm going to just focus on the lower part of the eardrum again. I'm peeling right to left, just to see if I can peel it away. So the patient knew immediately that they caused some trauma. As soon as they poked in the cotton bud, it became very painful, and they didn't have any blood discharging from the ear canal, but they had a suspicion that they had bruised the eardrum. So again, really stretching open the ear. So we're doing that using the right-hand side of the specular to push the first bend. So the first bend is made up of cartilage, and it's about 0.5 centimetre into the ear canal. So our ears are not straight cylindrical tubes, and they have bends and twists. So by, in the left ear, pushing the first bend to the right, we can somewhat straighten the ear canal. So I'm just zooming in here. And I'm just trying to peel it away. So it's almost a pitch black appearance, because dry blood does have that look. I just feel the last bit is still attached, so I'm gonna, I think in a moment now, use the forceps. So this patient's ear canal is so narrow, I'm not really able to insert the speculum any further. You can see the second bend just to the left. I think I'm just trying to get this in a position where I can then grab on to the forceps. It's still quite in a tricky position at the moment. But I want to almost align this in a portrait, just like this, so I can use the jaws at 3 and 9 o'clock. So that's perfect now for forceps. So we're just going to get the tip of this in focus. You can see that sharp ridge around the edge of this crusted wax and blurred. So I'm just using the forceps to slowly peel that away. I'm going to re-enter. So it's a bit traumatized to the posterior part, but there's a bit of hematoma on the eardrum, but otherwise it is intact. We did confirm that using a tympanometry test, which showed that the middle ear was compliant. Well, I hope you enjoyed that video, guys. Take care, keep well, speak soon. Bye.